Hello my friends, my name is Dr. Sayed Kazmi. Welcome to my YouTube channel, which is known as the Medical Channel, and it means the world of pediatrics, public health and epidemiology simplified. And in today's video we're going to talk about the problem of speech delay in pediatric practice. This is a common problem here in UK as far as the preschool children are concerned. And though the geographical prevalence varies by region, here in UK around 6% of the preschool children, they can have some form of speech disorder, and this actually leads to a great deal of parental anxiety because people are worried that their kids, they cannot speak, or they cannot properly articulate, or they cannot understand and hence communicate with them or with their family members. And keep this thing in mind that this issue of speech delay or speech disorder, this can either present as an isolated problem where there is only something wrong with the speech or with the language, but the child is absolutely fine as far as neurological and other developmental domains are concerned. Or it might be a part of a larger developmental problem where the child has got other neurological and developmental issues, and he is either globally developmentally delayed or he has got various neurological issues which might be responsible for his speech delay. Now you need to understand that there is a difference as far as speech and language is concerned. Now they are part of the what we call as communication delay, but speech is different from language because speech actually is related with the actual speaking of the words. So it's the vocal component of communication, while language is more than that. Now, in layman language, usually speech and language delays are used interchangeably, but in medical field they are different. So a speech disorder usually indicates that a child has got trouble producing certain types of sounds accurately. And young children who are learning how to speak will probably substitute or leave out or distort normal speech sound. This is quite normal for kids. For example, it's not unusual for a 3-year-old child to use the F sound of the in their speech. For example, if I say I'm thirsty, a child might say, like a 3-year-old might say, I'm thirsty. But that pronunciation would be considered an articulation error in a 5-year-old, as a 5-year-old would be having more, would have a more developed speech. So the same, use of the word F, like, pronunciation as an F instead of the, would be an articulation error in a 5-year-old child. So this would come under the domain of a speech problem. Now, language is different. Now, language means it deals with meanings. Children who have got a language disorder may have a difficult time understanding the meaning of what's being said. We call it the receptive language issue. So it can have issues with the receptive component, or there might be issue with the expressing, that is, they may have trouble communicating their own thoughts, where we call it the expressive component. So that would be expressive, mean that they've got a hard time actually expressing their feelings, their own thoughts. Now you just imagine a child who has got a good speech and he pronounces words correctly. Now this child can still have poor language, and he can have trouble putting words together to express thoughts, or he might have trouble understanding the meanings of what's being said by the others. So speech disorders and language disorders, they may occur separately, or sometimes a child may have both kinds of disorder at the same time. He might have issues with his speech and he might have issues with his language. Now, how do we know? Now, there are milestones. We call them developmental milestones that can guide you when you are considering whether the child's speech and language are developing typically or not. Most children, by their second birthday, they usually have a vocabulary of around 50 words. And by the time they are aged 2 to 3 years, most of them, they start understanding a lot more language than they can actually express. So some of the signs that could cause concern, or that can actually point that there is something wrong, is, for example, if a child doesn't understand name, like especially the word no. But these are simple commands. So if he is not able to understand by age 1 year, he doesn't understand, so there might be some issue with the language. If he isn't saying any words by the time he's, let's say, 15-16 months of age, some books go even up to 18 months of age, but that's the upper limit. So if he's not saying any words by that, that's a red flag. That's a speech red flag or language red flag. If he can't answer basic what, who, where questions by age 3, again, that might be a red flag that he has got some issues, or he's got difficulty being understood by people outside the family after age 3. That's another, sort of concern. Or he has got noticeable hesitations or repetitions in his speech if he's more than 5 years of age. So these are some of the I would call red flags which actually point that there's some problem either with the speech and language. But again, not two children are the same. Children develop their speech and language skill at their own paces. So, but if the child has got a red flag, it's important that he is seen by a pediatrician, a community pediatrician, or a neurologist, or even a general pediatrician. So the crux of this thing is that the speech and the language delays, they are different, though they can exist at the same time. So speech is basically associated with articulation of the word. So you are using the vocal apparatus, so the muscles of the jaw, the muscles of the mouth, the sound box, that is being used in a coordinated manner to produce vocal sounds. So if there is a problem only within that domain, that would be considered as a speech delay. But if there are problems with like understanding, with using other forms of expressions, like body language has got problems with understanding or cannot read, comprehend, then there might be a larger issue which is known as the language delay. So these things are important to understand, and it's important as a doctor to differentiate between these two. Now, the process of speech itself depends on a sort of a cycle which starts from hearing. So you need to have a proper working hearing apparatus, so which is actually your ear. So the ear canal, and that it's got the eardrums, and then you've got the ear and the vestibulocochlear nerve which goes to the brain. So this whole apparatus should be anatomically correct and physiologically correct as well. So it should be working in a proper way for the speech or the language to develop. Because a child who has got problem over here, he would not be able to listen. When he's not able to listen, he's not able to understand the language. He's not able to develop his language. So he's not able to develop his language. Obviously, he would have a language delay, and he can have a speech delay as well. So it starts with hearing, and then when hearing, once it goes to the brain, then it goes to the higher centers in the brain, and that is where it's associated with understanding, with thought and word processing. So a child needs to have vocabulary. Where does the vocabulary come from? The vocabulary comes from hearing words from the parents. As the child grows, the higher centers, as they mature, they develop their thought process. They start doing complex scenarios in their mind. So once they solve these complex things, then they develop their own thoughts. They develop some form of expression, and that expression can then be articulated in the form of voice. And again, when this has to be articulated, then there is a voice apparatus at the other end that should be working properly, and that voice apparatus consists of your mouth, your facial anatomy, which includes your tongue, the shape of the palate, obviously the muscles of the jaw and of the face, and the sound box and its associated nerve supply as well. So they should all be working in a proper way for a proper sound to be produced. So this is how the process of speech that works. Now remember that generally the problems of speech can be put into three domains. One is the neurological domain, then there's a psychological domain, and then there's an otological domain plus minus the anatomical domain, which I would consider as as combined with the otological. So psychological domain consists of all those problems like psychosocial deprivation, neglect, domestic abuse, things like that, which actually interferes with the proper intellectual development of a child and can present as speech delay. Then you've got the neurological domain. Neurological domain, the child has got organic problems in the nervous system, which can be of different types. They can have some form of CNS issues, or different types of congenital or acquired neurological problems which can manifest as speech delay. Or they might have anatomical problems and problems with their hearing apparatus, like problems with the ears, inner ear or outer ear, that can interfere with the development of the speech and can present per se as speech delay. But there is also a considerable degree of overlap as well, where a child might be having a combination of psychological and neurological issues which might be responsible for his speech delay, or he might have a combination of anatomical and neurological problem, or might have a combination of all these things, where neurological, anatomical, otological and psychological domain, they all would be present at the same time. And again, there are different reasons for that. I will come to that later on in my lecture. Now, as far as the assessment of and differential diagnosis is concerned, it's very important to start with a very good history. So you need to take a proper history, a birth history, which includes a good history about the antenatal events which might have contributed, like any antenatal infections in the mother. It also includes any perinatal events like a difficult labor, birth asphyxia, or postnatal events, especially if the child had extended jaundice, kernicterus, or he had any CNS infection like meningitis, which might contribute to hearing loss and then subsequently speech delay. It's also important to take a proper developmental history to see whether the child was able to attain his developmental milestone at the appropriate age or not. History of exposure to ototoxic drugs like the aminoglycosides, it's also important, because some kids who have been exposed to ototoxic drugs might develop problems with their hearing, and then obviously, because it's related with the speech, would present as speech delay. History of seizures, some form of developmental regression might be associated with seizures, because there is an underlying organic or metabolic reason for that. So if there is a history of seizures, you might think about those issues as well, and would need appropriate workup for those things. Also ask about family history of speech problems, because a child who has got speech issues in his dad and granddad, some of the things might be transmitted in a form of autosomal dominant manner. So kids who have got a family history where the dad or the granddad or the uncles had history of delayed speech, that child might also have a history of it might be normal for him to later on develop a proper speech, but at that point in time when he's presenting, he's simply delayed because he's got a family history of the same thing as well. And psychosocial history is also very important, because a child who is deprived emotionally and or is subject to domestic abuse, he may be so much emotionally subdued that he is not able to properly develop his language. So you need to take all these factors into consideration. So a very good history is important to know the causative factors for speech delay. Now, as far as the clinical assessment is concerned, it's important that you generally, when you're doing a general examination, look for any signs of dysmorphism. So a child who has got any dysmorphic features, like features of Down syndrome, obviously you know that some of the syndromic diseases, they have got neurological impairment, and obviously then speech delay is one of the sequelae of these things. So look for dysmorphism. Do a complete developmental assessment. I have a separate lecture on how to do developmental assessment. So look for all the domains of development: gross motor, fine motor and vision, speech, language and hearing, and then the social domain. So see whether a child is just delayed in his speech component, or is he globally delayed and he's got issues in other domains of development as well. Do a complete neurological assessment to see if there is any central nervous or peripheral nerve involvement. Also do a proper orofacial examination to look for any anatomical abnormalities that might interfere with speech, like for example a high arch palate, or let's say micrognathia, or a big tongue like macroglossia, or let's say some form of problems with the larynx, like a constricted or a small larynx. And it's also important to look into the ear and do a complete otological and audiological assessment, where the child is subjected to hearing test to see if he's got any loss at various frequencies, to see whether that goes more in favor of a conductive deafness or a sensorineural deafness. So, and ear examination and an audiological examination, they are always a must. So your assessment is never complete unless until you have done these things. Now the differential diagnosis, again I come back to the same diagram, that a child might have just purely psychological reasons as a reason of his speech delay. He might have just neurological reasons as a cause of his speech, or he might have otological and anatomical reasons for his speech delay, or he might have a combination of neurological and otological, or psychological and neurological, or maybe a combination of all these things. So for example, deprivation and neglect or selective mutism, these are psychological issues. There is nothing wrong as far as the physical parameters of the child is concerned. It's just the psychological domain because of which he has got problems in his speech. Again, your history and assessment would guide you whether it's purely psychological or he's got other components of neurological and otological involvement as well. Neurological, like a child who has got cerebral palsy and child who's had meningitis might develop issues with his hearing, and that would then manifest as speech delays as well. Similarly, a child who has got chronic ear infections, glue ear, has got orofacial anomalies, obviously there will be problems with articulation and he might not be able to develop a proper speech. Or a child, this is also very important, that one common reason of speech delay in children is autism as well. So it's very important while you are examining when you do the developmental assessment, to see if there are problems in the social domain as well. So if a child who doesn't speak, well, the parents say he doesn't speak, but that child, you see that there are stereotypes, he doesn't make much eye contact, he is busy in his own world, doesn't pay attention to what is happening around him, is not inquisitive for his age, then obviously you should think about autism, and then you need to do further assessment on the DSM-5 criteria or the ICD criteria to see if the child fits within the domain of autistic spectrum disorder or not. Or there might be a combination of psychological, otological, neurological problems, like if a child who has got global developmental delay because of some form of metabolic neurological disorder, again they would be having dysmorphism, they would be having organomegaly, they might be having global developmental delay, they might be having different types of issues. So again, this is just in a nutshell, you should know that these are some of the broad causes of delay in speech. Now, as far as management is concerned, it depends on the underlying cause. Again, so if the underlying cause is an ear problem, you have to treat the ear problem. If the underlying cause is, let's say, a sort of a neurological disorder for which you can't do anything, then obviously there is nothing you need to explain the prognosis, and he might need some form of sign language and then some form of speech therapy in order to develop at least some of the speech where it's at least the child can communicate to some level. So as I told you earlier, that most of the cases have ear or audiological issues, so early specialist ENT opinion may be required if you think there's something wrong with the ears, or if the child has failed an audiological test or there are issues or on the audiological examination. In case if the child has got orofacial anomalies, then corrective surgeries may be required. So it might be a multidisciplinary team effort where the plastic surgeons and the maxillofacial surgeons might be involved. Autistic children, as I told you, that autism is a common cause of speech delay, and it requires its own special treatment. So obviously there are people who are expert in treating autism, and there are speech therapists who deal with autistic kids. So these children, they might require referral to the speech therapist, who can then try to develop their speech to some extent and help them in regaining their speech or developing their speech. Just to highlight the problem of speech delay and how we manage that, I will just present a case study. So this was a 2-year-old boy who presented to his GP because of the reason that he was speaking fewer words than his peers, and he had difficulty in non-family members understanding him. So he had a very small vocabulary. So on closer questioning, he just had less than 10 words of speech. So at 2 years, he just had less than 10 words. So ideally at this age he should be having at least 40 words. So he was born at full term, 39 weeks, by normal delivery, and he did not require any special care baby unit, so he didn't require any resuscitation or any special measures at the time of birth, and he passed his newborn hearing screening. So he had intact hearing at the time of birth. He was not having any congenital hearing problems. So a review of his personal health records, red books as we call it in UK, it showed that he was growing along the centiles line, so he was growing well, and his other developmental milestones were achieved at appropriate age. In the consultation room, he was playing appropriately, he was making good eye contact, and was following instructions. So he did not show any autistic symptoms. He was able to identify his nose and ears when asked, so he could understand. On examination, he had normal faces, so there was no dysmorphism, no orofacial anomaly. And when the doctor looked through the otoscope, it revealed bilateral dull tympanic membranes. So the tympanic membranes were not shiny, they were dull. It simply means there was fluid behind the tympanic membranes. So a referral to audiology was made, and they did his age appropriate free field hearing test with tympanometry, and he had hearing thresholds of greater than 40 decibels, which is considered to mild to moderate hearing loss, with flat tympanograms, which actually indicated a conductive hearing loss, keeping in view with otitis media with diffusion. So he had an audiological examination, and he had some form of hearing loss which was greater than 40 decibel range, which is consistent with mild to moderate conductive hearing loss, and that was because of his glue ears, so there was fluid behind his ears. So according to NICE guidelines, kids who have got otitis media with diffusion, we usually watch them for 3 months. Within 3 months, if it resolves on its own, well and good. If not, then these children are usually offered some form of ENT intervention, usually grommets. So for 3 months, this child was actively observed and nothing happened. So he was referred to the ENT throat consultant, and because he had a persistent conductive hearing loss, he was offering hair aids or grommets, which are according to the NICE guidelines. So his parents selected for grommet insertion, so grommets were inserted, and after 6 months, when he was 2.5 years of age, his vocabulary had expanded to greater than 100 words. So from 10 words, he went up to 100 words. Why? Because the grommets were placed, which drained the fluid behind the ear, and now he could hear. And you see, within 6 months of time, as he was listening to different words, he developed his vocabulary, and his then repeat audiological test, they came back in the normal range. So keep it in mind that speech delay, important things to look for is, the first thing is to see if the child has got proper hearing operators. This is one of the most common causes of speech delay. Number 2, also look for any autistic features. If the child is otherwise fine, and you see that he's not making eye contact, he's got stereotypes, he's got his own routines, and he doesn't give much attention to the environment, then you should think of autism and do further tests, screening tests for autism, because then these kids wouldn't require referral to speech therapist who can then do their job and help them in developing some form of speech. So I hope you have understood some of the common causes of speech delay. If you've got any questions, you can put it down in the comment section below, and I will answer them as soon as possible. If you haven't subscribed to my channel, do subscribe. It helps. It gives me further motivation to make videos for you. And if you like my videos, give me a thumbs up, share it with your friends, and have a good day. Bye bye.